Welcome to CIHT Podcasts.
Thanks for joining us. This podcast will explore the links between transportation and health. Reduce your risks of heart disease and cancer by almost half. What is the magic cure? According to a recent study by the University of Glasgow, cycling to work might provide the answer. You're listening to the first joint podcast between CIHT, the Chartered Institution of Highways and Transportation, and ITE, the Institute of Transportation Engineers. My name is Justin Ward. I'm delighted to be running this with Bernie Wagenblast. He hosts the excellent ITE podcast series. I will hand over to Bernie now.
Well, thanks for joining us. My name is Bernie Wagenblast. Joining us as guests are Lucy Saunders, a public health specialist with the Greater London Authority and Transport for London, as well as Dale Bracewell, the Manager of Transportation Planning for the City of Vancouver in British Columbia. Welcome. Glad to have you with us. Justin, why don't you start us off?
Dale, I'd like to put the first question to you. What have you done or what are you working on to better integrate health considerations into your transportation decision-making process and individual projects?
Well, Justin, it starts with our long-range transportation policy framework, which for us is a document called Transportation 2040. And we have three overarching goals, economy, environment, and people. And so really, transportation is always about moving people and moving goods. And so when it comes to people, we're always now in the conversations about healthy citizens, helping them be able to move around in what we want to keep, which is a safe, accessible, and vibrant city. And then it doesn't end there. And so what we've been doing is with that long-range transportation plan that's been approved by the City Council is then making close alignment with other plans. And so, for example, we have a significant amount of transportation directions also represented in our citywide healthy city strategy, sections of getting around, but also understanding the social and the mental and the well-being health aspects that relate to transportation and areas of environments to thrive and active living and getting outside. And so all that combined also is kind of where we're going from an overall policy framework.
And Lucy, it's happening in London that you're involved with.
I developed something called the Healthy Streets approach, which is very simple, deceptively simple in fact, because it's quite complicated to deliver, but it's 10 indicators of a healthy street, so 10 things that we should be able to see and experience on every single street in any city in the world. And these 10 indicators include some of the things you'd expect from a public health specialist such as myself, so clean air, not too noisy, people feeling safe, and also a range of other indicators that people maybe didn't always realise were really important for health. So places to stop and rest are really important for ensuring that people who have got mobility issues and older people are able to go for a walk and take rest along the way. Shade and shelter is really important in terms of inclement weather and strong sunshine that can exclude some groups. So it's quite a broad framework. And this Healthy Streets approach I first introduced in TfL's Health Action Plan. So that's Transport for London's plan on how it would embed the Healthy Streets approach. And I've spent the last 3 years delivering that plan. It's largely about changing the culture and decision-making within the Transport Authority to put considerations of human health into the decisions that we make and the way that we communicate with each other. And as a result of the last 3 years of work, this has now become really central to the overall transport strategy for London. So we are going to be publishing the new Mayor's Transport Strategy in the coming weeks, and the Healthy Streets approach is going to be really at the centre of that strategy. So this is meaning that all of our transport decision-making has to be judged on how it delivers in terms of the human experience in relation to those 10 indicators of a healthy street.
Lucy, I think you touched on this a little bit in what you just said, but I'm curious, Dale, in Vancouver, obviously the first two things that come to mind when people talk about healthy transportation are walking and cycling. But are there other elements in Vancouver that also go into the mix?
Well, absolutely, because the streets are, all part of the public realm. And so we've also been complementing our active transportation efforts with a public space and those high aspirations of urban design and making it all fit together, because then these places that we want to be able to encourage more people to be able to walk and cycle to the places that they want to go to. But along the way, building off of what Lucy said, when we were doing our Comox Greenway and talking about walking and cycling and what else, seniors, of course, in particular, saying, well, please provide more benches, provide those, gathering spaces, provide places not only to rest, but opportunities. And so we have all sorts of things that we have in our public space area called the Viva Vancouver team that's kind of looking at temporary opportunities to reallocate road space, not just for the benefit of then the walking and the cycling that we're definitely trying to encourage, but really anything else that helps people move around, be more physically active, improve their health, and being less sedentary and kind of being able to enjoy the city more.
Could I add to that with something of what's happening in London? We obviously have very high levels of public transport use in London, much higher than the rest of the country. And for us, that's really a core part of delivering a healthy system as a whole, because not only from a physical activity point of view, half of all of the walking that people do in London is walking to and from bus stops and train stations. So if we don't create a great public realm, we can't enable them to access our public transport system. But the health impacts aren't just about the physical activity benefits of walking and cycling, but they're also the potential negative impacts that we have to try and reduce, so the harms of air pollution, of noise, of road danger. So we have to think about all these things in the round, which is why it seems like it's quite a simple thing to do, but in fact it's very complicated and all-encompassing. And coming back to what Dale was saying about our role in terms of guardians of the public realm, it means we have to work with a lot of other stakeholders as well, because to make our streets inclusive environments for everyone, we have to work with businesses, we have to work with the authorities that are managing the cleansing regime of the streets and the planting, we have to work with local residents and community groups. So it becomes a very complex, multifaceted project to try and deliver really healthy street environments.
In terms of the complexity, what challenges or even opposition have you faced in terms of trying to drive forward the Healthy Streets agenda?
I would say that in terms of making the case for considering health in transport planning, it's definitely got a really strong legitimacy. I don't see anyone disputing the importance of us thinking about health as well. In London, there's a particular focus on air quality at the moment as being a particular issue, and there's less of an understanding of the importance of active travel to enabling people to be physically active every day. It's not as well understood as it could be that actually if people aren't travelling actively as part of their daily routine, it's highly unlikely they're getting the minimum activity that they need. So if we're not delivering that activity through active travel, then we're failing our communities in terms of enabling them to be active and healthy every day. I think there's sometimes a misunderstanding that to make a transport system or to make a street environment better from a health perspective is somehow at odds with business interests. But what we find talking to our business improvement districts is they're often the ones who are really championing most of all for us to deliver healthy streets, because they can see that a street environment that's attractive and appealing for people to walk and cycle and use public transport is really beneficial to their business area as well.
Maybe I can add to that because, Lucy said it well that, people generally speaking understand and get the health benefits of the types of things that we want to do on our streets to make them healthy streets and promote walking and cycling and the public space goals as well. But what we learned as a challenge is that that's just not enough. To be able to kind of point to the great PhDs and doctors who have documented this very conclusively, what we had to do is we had to do our own research at kind of our local city and community level. And so back to that Comox Greenway that I mentioned, we partnered with which is, I think, a great opportunity for cities, municipalities, and regions to do, and did a good pre-post, before and after study of the benefits of this greenway. And so what we were able to do in our own local public context is be able to go back out to our Vancouver residents and as Lucy said, the business community, and very specifically say, there was a 16% increase in how people engaged in more physical activity once the greenway was completed. It decreased 8% the time people spent sitting or being sedentary in whatever their lives are, and then also a significant decrease, a 10% decrease in the number of days that they reported having either poor or physical mental health. So again, that was a challenge for us to just be able to kind of talk about health, and the way we overcame that was to do some very Vancouver-specific studying that mirrored the larger studies, but it proved to be very helpful to bring that to our decision makers and our community.
When it comes to making transport healthy in both Vancouver and in London, is it primarily a case of just making it easily available and attractive healthy transportation, and people will naturally migrate to using it, or did you have to do any prodding of the public in either London or Vancouver?
I think it takes effort to draw people's attention to, sometimes to remind them and sometimes to educate them about the significant health benefits that when we're making the right sustainable transport decisions in our cities and our communities. And so, for example, we're well known as a green city and caring about the environment, and so getting their attention around and why they should care from a health perspective has been something that we needed to pay attention to. And so, again, linking though transportation into beyond our own plan, that Transportation 2040 plan, into Healthy City Strategy, the main deliverable to implement out of the Healthy City Strategy is what is now our Active Transportation Promotion and Enabling Plan. And so we've drank the Kool-Aid that, of course, it's not just about building the infrastructure. That's not enough. You do need to make context-specific promotional and enabling efforts. Let them know about the walk-bike network you have. Let them know how it's changing and getting better and helping to transform their city. And then the other one that we needed to do was we had to do our own custom market research. The behavior challenges and the reasons why people are walking and cycling for Lucy in London may be the same, but they might not be for our Vancouverites. And so we needed to do our own market research so that at least with the limited dollars and efforts that we can put as staff and with partners, we're targeting and enabling the most amount of healthy walking and cycling in our city.
Yeah, I would say that an issue in a city like London is that we have limited amount of space. So if we want to put in more space for walking and more space for cycling, we have to take it away from some other use on that street, and at the moment that is often private car use. And so we don't have any choice but to address this issue head on of how do we want to use cars in our city, and what is the right and fair way to use this amazing technology in a city so that it delivers the benefits without delivering a whole load of harms along with it. And a couple of years ago I published something called Health Impacts of Cars in London, just to put down all the evidence of the health impacts head on in relation to cars. Previous to that, we very much focused on the benefits of walking and cycling, but they're two sides of the same coin, so we have to talk about them together. And our new administration has really taken the bold step of talking about car use in a way that we haven't seen before. So we recently published Healthy Streets for London, and that does talk about the need to manage the use of cars in the city and reduce the impacts that they have on people's health. So, yeah, if we want people to walk and cycle, we have to make it more easy and more attractive to do that than to use a car. And that does mean that we have to look at some quite contentious policies, and some of the most difficult issues to discuss are car parking and car use in cities, and we kind of do need to go there if we're going to deliver the health benefits that everybody wants to see.
The Olympic Games that you were involved with, Dale, in 2010, were there objectives in terms of shifting people to more active travel, walking and cycling, to manage the traffic volumes for the Olympics?
Yes, very much so, because when we hosted the 2010 Olympic Winter Games, we wanted to be a city that truly hosted the world and did a fantastic job helping the athletes, the officials, and the media get to where they needed to be, and of course having to manage very much what Lucy said, some additional road space challenges where certain streets had to be closed for security reasons, or we actually, kind of building off what she said about transit being a priority, we provided a lot more Olympic lanes that, again, athletes were able to move on, but also our public transit buses. And so in the end, we needed to also tell our public, well, we're going to have to think about things differently, and part of that is about more walking and cycling and transit, because this is your city policy in terms of what we want to do, and it's a way to look forward, and at a scale that was unprecedented. But it became a magnificent catalyst for being able to talk to people, and I got to give great credit to our regional transit agency that really stepped up in terms of providing that extra transit. But a cornerstone of knowing of that and knowing what we needed to do and being able to talk to our public was having a good set of transportation data to be able to educate and help them and bring them along to the challenge. Because what we also were doing for hosting Olympic Games is we wanted our residents and our businesses to celebrate. And so an easier way to deliver Olympic Games, for example, is to tell your local people to stay home and just kind of let the Olympics happen and make it look great on the international stage through the media. But that's not the Olympics that we wanted. And we said we actually are going to have to handle that many more trips. And so, again, if everyone does their part, does some part to leaving their car at home for some trips, then we all win and we all celebrate and have a great Olympic Games.
When it comes to measuring the success for this, you both talked about how you gathered the statistics and laid out the need for healthy transportation. But are you being asked to show that this is working? And if so, how are you showing that?
That's a really, really good question. For one of the most straightforward ways of measuring the health benefits of a policy is to do a count of your pedestrians and a count of your cyclists, and then after you've made a change, you do another count of your pedestrians and your cyclists. But in our city, because people are walking as part of their public transport trips, and car use is relatively low in the inner part of London, we can't assume that an extra person on a bicycle is a person who's got out of a car, so that it's not necessarily someone who's moving from being inactive to being active. In fact, they may be moving from a 20-minute walk to and from the tube station to a 10-minute bike ride, so they could be doing less exercise. And what that means is we are held to a very high standard in terms of demonstrating the benefits that we're delivering, and we have to try and really get a detailed understanding of what Londoners are doing, how they're travelling, and how that changes when we make changes in redesigning junctions to make them safer or putting in a cycle track. How many of the new cyclists on a cycle track are people who weren't cycling before, and how many of them are people who were on a whole range of surrounding streets who've now just moved across to this new infrastructure. So we're trying to collect data as best we can. We have a very large survey called the London Travel Demand Survey, where we have questions of 8,000 households across the city that we ask on a rolling basis throughout the year. But we find that even that data, it can't keep up to date with small changes in local areas in London. So we're now looking to mobile phone data and what else could we do that would help us to understand how the changes that we make and the policies that we put in place result in people changing their behaviour.
Well, I would just add to that what we've had to do is rethink the type of data that we're collecting for transportation to ensure that we're getting indicators about the health of our residents and the relationship that they have to transportation mode decisions. And so we've ventured into new territory that we're really excited about, that we used to depend on our regional authority to get 24-hour daily trip data once every 4 years. And that's just not it's just not enough, and it wasn't specific enough to the decisions that people were making for walking and cycling and actually understanding the health benefits. So I'll just kind of use one example is we do an annual panel survey now of a large sample of Vancouverites. And one of the questions that we've tied into knowing the health is this whole idea, and I've loved working with health researchers and partners because as a transportation planner, transportation engineer, I never used to use the word social connectedness. And so what now we're doing and measuring in our annual panel survey is when you chose your mode, did you have a social interaction? And so, for example, we're able to tell our mayor and council that active transportation choices made by people in Vancouver have the highest amount of social interactions. Next is transit, and lastly is the choices that people are making to be in a car. And so we're really being able to use then and leverage the transportation data to continue on with the importance of the health and transportation link, and how that really builds out a better, robust, livable city.
We've been looking from the Healthy Streets perspective at these 10 indicators of a healthy street, and how can we measure our 10 indicators as a proxy measure for health, because it's actually not really possible to be able to say, I put this policy in place and as a result lung problems are reducing and children's development is improving and sleep levels are improving. So there's a whole range of ways in which transport impacts on health, but those health outcomes almost impossible for us to be able to directly link. So we use the 10 Healthy Streets indicators as our proxy measure, the link between what we do in transport and what we know delivers a benefit in terms of health. And we've taken two approaches to that. One's qualitative and one's quantitative. So for our qualitative research, we've actually been out onto the streets of London and we've asked people on the street to tell us, right here, right now, can you rate this street between 1 and 10 in terms of how clean you think the air is? Can you rate this street between 1 and 10 in terms of how safe you feel or how noisy you find it, or whether you would choose to walk and cycle on this street? So that qualitative data has been really interesting to show how different kinds of people really experience the street very differently, and it really emphasises the importance of creating inclusive streets for everyone, because the fit, healthy transport planner who's writing the policy probably really struggles to imagine that there are lots of people who can't walk more than 400 yards without taking a rest and who really need somewhere to stop, or that actually a mother with a buggy and 2 other children can't walk down a street where the pavement's only 1.3 metres wide because she can't fit her whole family together in the space that's provided. So it's been really useful from that point of view, but the qualitative data, we can't use it for every single scheme that we deliver or to get a good picture of every single street in the city, because it would just be phenomenally expensive to go out and ask those questions of people on every street in a city with 8.7 million people living in it. So the other tool that we've been using as a proxy for our Healthy Streets indicators, it's still in draft, but it's called a Healthy Streets Check, and it takes a set of quantitative measures that we can assess for a street before we make a change to it, and then we can go back and we can measure it again after we've made the change, or we can even look at a plan and work out how those indicators would change if we implemented a plan, and that helps us to make sure that we're covering off all the bases, that we're not forgetting important things, and that we're not designing in things that we know don't work for pedestrians, or things that we know put cyclists in danger, for example. So the Healthy Streets Check is probably more widely applicable, but its weakness, I guess, is that it doesn't ever give you the same human experience that you can get from actually measuring data directly with human beings. It's only ever going to be proxies on what we think in terms of street design relates to human experience. And sometimes you really have to be there to feel it, and you can't get it from looking at a plan.
And what advice would you give to others who are interested in doing what you've done in terms of making streets healthier, making places encourage better lifestyles, I suppose?
I'll kind of transition from what Lucy said. And Lucy, by the way, it sounds like you're doing great things there in London. And so building off the qualitative, quantitative thoughts, we're doing that as well. And so, for example, when we introduced our first set of protected bike lanes, cycle tracks, we're measuring data differently, even the counts. And so we're looking at the demographics and the gender. And so the number of women cycling at least is used as an indicator in terms of the perceived safety and comfort. And so we saw a significant increase from 28% were female cyclists on a Hornby protected bike lane painted bike lane, and then when we converted that road space into a protected bike lane, all while the numbers of people were increasing, the percentage of female cyclists increased to now pretty much 40%. And so getting different data, and that's obviously a quantitative, and then a qualitative one, which helps at least diffuse. It doesn't solve the road space challenges as we go through kind of more walking and cycling corridors, but just, qualitatively, Vancouverites are saying, I think the city should do more of those protected bike lanes and giving dedicated space for people cycling. And so really the challenge comes then more around to the design of a specific corridor and a specific project, but being able to kind of talk about the data, and then what we do is we actually put that into an annual report card on walking and cycling as our best practice. And so that's advice to transition to others, is that not only hear this podcast and hopefully glean something that you can do, but be all the way kind of following through to being able to kind of publish and talk about it at your equivalent of your mayor, council, and decision makers. And then to kind of bring back and weave in some of the earlier stories and references for Vancouver is, what I've learned is, your health authority are the great partners and allies for you in transportation. In fact, they're some of the best people to work with in terms of achieving your transportation goals. So consider some really close relationships. We've gotten to just naturally we progressed into whether you call it a memorandum of understanding or a partnership agreement, and basically because we do recognize that we actually have so many shared goals. And when we're working well together, health partners and transportation planners, transportation engineers, it really does build a better city. And so I'll just give one recent example of the fruit of that, because these are years in the making, and some wins come earlier than others, but by bringing up the idea of getting hospital data to kind of complement what was, largely speaking, a vast amount of transportation safety data that really was focused around the car, but now with in partnership with our health partners and our main hospitals, we're able to now look at hospital data to better advance and be more efficient towards our Vision Zero safety goal, again, one of our large transportation plan goals. And the other example is in that relationship that the chief medical officer for Vancouver will often be a first speaker, in terms of the public speakers at a contentious transformation of our transportation landscape, because again, they're coming to speak to the health and the safety benefits of that proposed change.
Well, listening to this conversation, I think we've only really scratched the surface of so many interesting topics when it comes to healthy transportation. I hope we've whet people's appetite, and they will be able to go and get some more information and search out what they can do in their own cities to make their cities more healthy when it comes to transportation. But unfortunately, we've come to a point where we have to close this particular episode of the podcast. Once again, I want to thank my co-host, Justin Ward. He's a Senior Policy Officer with CIHT. And our guests, they are Dale Bracewell, the Manager of Transportation Planning for the City of Vancouver, British Columbia, and Lucy Saunders, a Public Health Specialist with the Greater London Authority and Transport for London. Thank you all for being part of our joint CIHT ITE podcast.